KTN.
Staying with health, as the strike by health workers under the Universal Health Coverage Scheme stretches into its fourth month, Health Cabinet Secretary Aden Duale has made a startling admission that the government has been unknowingly paying salaries to ghost workers hired during the 2020 pandemic. Speaking after a tour of Kenyatta National Hospital, Duale revealed that an audit is underway to determine just how much was lost and how long the phantom payments have been occurring. Winfrey Owino brings us the developing story.
It's been over 3 months since health workers under the Universal Health Coverage UHC program downed their tools, demanding permanent contracts, pensions and better working conditions. Today, they were back on the streets, still unheard, still demanding answers.
We do not support the fact that the government is claiming that they are ghost workers. Because if they are ghost workers, it is the government which knows who are these health workers who are ghosts.
But now, a startling admission from Health Cabinet Secretary Aden Duale has shifted the spotlight. He has confirmed the government has been unknowingly paying ghost workers hired in 2020 during the height of the COVID-19 pandemic.
We'll visit every county and we shall do a head count. These UHC staff were recruited long time ago, 5 years ago. Some have left, some are working for the counties. The numbers the county governments are giving and the numbers we found in Afia House are not tallying.
According to Duale, an investigation is now underway to uncover the scope of the financial loss, the duration of the payments, and just how many non-existent employees have been quietly drawing salaries.
The men and women who were at Afia House then will pay for that money. We will not pay. And before we transit to permanent and pensionable, we want to know, do we have 5,000 UHC staff or do we have 8,000?
This comes just a day after the chair of the Health Committee at the Council of Governors, Tharaka Nithi Governor Muthomi Njuki, revealed that over 3,000 health workers being paid by the Ministry of Health are unaccounted for. Originally hired under the National UHC initiative, the striking medics are now being transferred to county governments effective July 1st. However, governors are pushing back, citing lack of funds to absorb and sustain the workforce. To complicate matters further, Health PS Dr. Ouma Oluga claims some county governments have submitted inflated lists reporting more medics than they have actually been paying for in the last 5 years.
So when they submit that list like that, we do not submit the list to the Treasury, and the Treasury does not release that money. It's based on an actual return.
As it stands, the future of UHC workers remains uncertain, caught between bureaucratic confusion, payroll scandals, and a healthcare system gasping for reform. Whether they will return to hospitals or remain in the streets is a question only time can answer. Winfrey Owino, KTN, Nairobi.
Let's now talk about